Okay, so I'm looking for any danger in the room. I can notice that the brakes aren't on, so I'm going to put the brakes on the wheelchair. And I notice that one on the right side isn't working very well. Okay. Now, if the back of the wheelchair was able to tilt, I could tilt back the back of the wheelchair, making sure that I don't tilt the whole wheelchair back. And I need to make sure I then move the patient, if possible, over to one side so that any fluid, food or fluid can drain out of her mouth, and try to maintain her airway as much as possible until the seizure stops. If she was to fall out of the wheelchair, there's several things that I could do. I could remove the foot plate, so on this wheelchair I can do that, and probably quite safely. I could also consider putting something in between the patient and the wheelchair to minimise any injury. If, for instance, one of her hands was trapped, say, in one of the sidebars or something, I could try and move that, provided that it wasn't causing any further injury. I have to also note that injury is unavoidable, really, in these situations when a wheelchair is involved. I should try to minimise any injury to myself and not put myself at risk at all, and make sure that maintaining head and airway is the most important thing, and if she does have any injuries, wait until the seizures stop to treat them. So once the seizure's stopped, it might take the patient some time to come to, and after the seizure has stopped, this is when we can consider moving them into the recovery position. Now, because I'm on my own, it's not really safe to do so in this situation. I have an unstable wheelchair with one brake not working, and I'd actually be putting myself more at risk by moving the patient to the floor for recovery position. Things that I shouldn't do during this treatment is not tilt the whole wheelchair back, which I discussed earlier, not putting myself at any risk. I'd also not put anything into her mouth. I'd not move her unless it was absolutely necessary, and I would try not to restrain her and let her move freely during the seizure. If for whatever reason, there's 8 reasons in which I would consider calling an ambulance. That would be if the seizure lasted longer than 5 minutes, which in this case it hasn't. If it takes longer than 5 minutes to recover, I can consider calling the ambulance as well. If I have any doubt at all, if she sustained any injuries, I should also call the ambulance. If it happened in water, I should also call the ambulance. And if there's any food, fluid or vomit in her mouth, an ambulance should always be called for a medical assessment. And if she has any breathing difficulties after the seizure, the ambulance should also be called in those circumstances. Thank you.